So today we wanted to talk about wellness exams or preventive care exams, why we do them, what is the potential benefit to you and your horse from doing these exams. So basically a wellness exam is like a physical exam that we would have done at our doctor. And for our patients, we recommend that this be done every 6 months to check their vitals and their general health, to give the owner a better idea of how the horse is doing and maybe pick up some things that they wouldn't notice with their day-to-day care of the horse. So wellness exams or preventive care exams are really tailored to the individual horse. So a geriatric horse might require a different exam than a foal would get, and an athletic horse or a sport horse might require a different exam from a pleasure horse or a pasture ornament. So the first thing we do as part of our exam is just take a general look at the horse's condition. What is their body fat like? Are they cresty? Is their fat evenly distributed? Are they bright and alert? Do they look like they have a normal attitude? And do they have a normal breathing effort? Those sorts of things that we can all learn just from observing from a distance. Also, we can look at the horse's muscling. Are they normally and evenly muscled for their body shape and size? We can pick up a lot of diseases based on that alone. For example, on wellness exams, we often diagnose horses with muscle disorders such as PSSM. Occasionally, we'll see some muscle atrophy to neurologic conditions like EPM on a routine wellness exam, as well as some more rare conditions like equine motor neuron disease, which is similar to Lou Gehrig's disease in people. So just from a quick look at a horse, we can learn a lot about their general health. Also, another thing we pay attention to is the horse's color. Horses that are of certain colors and breeds will be more prone to certain conditions compared to others. Gray horses, for example, are very prone to melanomas of the skin that can appear in any part of their body, but certain areas that we pay close attention to, maybe the corners of the mouths, maybe under their sheath area, under their tail head, around their anus, and that sort of thing. So as part of our wellness exam, we'll often start with the front end of the horse, and we'll take a good look at their eyes. Things we'll often see with horses' eyes. And a horse that's gray, we'll want to check for tumors in the eyes. We do see melanomas in horses' eyes that are especially in gray horses. We also see skin tumors around their eyelids and sarcoids around their eyelids regularly. We'll also check their eyes for uveitis. We'll also check for cataracts and that sort of thing that we regularly pick up on wellness exams. While we're working on this end of the horse, we'll also check their gums for good normal mucous membrane color. Okay. We may check their age, especially if their age is unknown or uncertain. And then, of course, get a look at their molars or grinding teeth to check and see if they're sharp and need to be floated or not. Part of our wellness exam always involves listening to the horse's heart and lungs. We do hear a lot of heart murmurs in horses and a lot of arrhythmias in horses. Some of these may be important to their health and some may not be. If we detect an arrhythmia on our auscultation of the horse's heart, we may then decide that we need to do an EKG to further check on that horse's arrhythmia. We also detect a lot of heart murmurs in horses. Horses have very large hearts with a lot of blood flow, and this leads to a lot of turbulence and a high rate of heart murmurs. So when we find heart murmurs in horses, we will document them, maybe do an ultrasound if that is indicated, or maybe just monitor them for worsening over time. When we're done listening to the heart, we'll take a good listen to the horse's lungs and evaluate their respiratory effort. We see a lot of horses in this part of the world that have asthma and routinely detect it on some of our preventive exams. Another important part of our preventive care exams are checking the horse's feet and legs. So we'll do a palpation of the horse's legs, check for swollen joints, sore joints, decreased range of motion in their legs, arthritis. We'll also check for their arterial pulses. If they're of increased intensity, that may be an indication that the horse has laminitis or is pre-laminitic if they're a high-risk horse. We'll check the legs for swellings, range of motion in all the joints, and perhaps do a lameness exam if that is indicated based on what we feel during palpation. Moving back on the horse with our exam, we'll often take a quick look at the genital area. For geldings, we like to look for tumors in the sheath area. if needed, if there's swelling or an indication, maybe also exteriorize the penis so we can get a good look at that area. We do see a fair bit of penile cancer in horses. We'll then move to the back end. Okay. Check the skin for any issues, the perianal area, the vulvar area, common area for tumors of different types and sizes in horses. In gray horses particularly, we see a lot of melanomas in this area. And then of course, we'll take the horse's temperature when we're back there as well. Especially important during a routine exam, we'll often pick up horses that have fevers for various reasons. Maybe viral infections or that sort of thing. And very often we'll pick up that before we do vaccination as part of our routine exam. So in summary, routine preventive care exams are very important for your horse's health and help us to identify a lot of ways that we can help manage your horses better. One of the more important things or most important things that we do during these exams is a consultation about your horse's nutrition. And whether that be for an easy keeper or a hard keeper, there's a lot of recommendations we can make based on what we learned during exam, and also getting a report from you on your horse's performance depending on what they do.